Hello class, today I will be teaching about the topic critical care unit. This is another topic from a new unit and this is for BSc third years. So let us see with the introduction. What is a critical care nursing? Okay, critical care nursing, it is a field of nursing with a focus on the utmost care of critically ill or unstable patients. So, what do you mean by critical? Critical means life-threatening, okay, or very, very urgent, or case of emergency, okay. So, critical care nursing, it is a type of nursing care which is being provided by the nurse or by an ICU nurse to a patient who is unstable or who is at the risk of dying, okay, so, or they are critically ill, we can say. So that type of nursing care we give to the patient is called critical care nursing. Okay, so it is a field of nursing with a focus or which focuses on providing the utmost care or providing the professional or the perfect care to the critically ill patient or the life-threatening patients or unstable patients. That is critical care nursing. Then next is critically ill patients. Critically ill patients are those patients who are at the risk of dying or who are at the risk of having life-threatening health problems. Okay, so next is critical care unit. Critical care unit or CCUs. Okay, or we can call it as intensive care unit (ICUs). They are designed to meet the special needs of acutely and critically ill patients. These units, okay, so like ICU, you all are aware of ICUs. Everyone has been posted in ICUs. Okay, it can be pediatric ICU or medical ICU or surgical ICU or respiratory ICU. So you must have some idea what an ICU is all about. This ICU is a special unit that provides special care or provides very important care to the critically ill patients or those patients who are at the risk of dying. Okay, so that is critical care unit or CCU. Now, critical care nurse. Okay, she or he must be a very experienced nurse. She should have high knowledge, very good knowledge about critical care, about the ICUs. Okay, and she should have high skills, good knowledge, and she should be very good in practice also. So, critical care nurse care for patients or clients who are very ill or who are at the risk of dying or who are having a life-threatening situation. Then critical care nurse provides direct one-to-one care. So here the ratio of nurse and patient is 1:1. Means that one nurse will take care of one patient. Okay. So in ICU the standard staffing pattern is 1:1. Okay. So that means that it provides direct one-to-one care. Next, the nurse is responsible for making life and death decisions. Then, at high risk of injury or illness from possible exposure to infection. So the nurse should be very skilled in providing care to the patient, and she should be able to prevent from any complications like further infection. Next, the nurse should have good communication skills. Okay, why? Because she has to communicate with the patient if he or she is stable. She has to communicate with the family members. She has to communicate with the nurse, the other nursing staff, and she should be able to communicate with the doctors also, and also the lab technicians. Okay, the housekeeping staff. So she should have good communication skills. So these are some of the responsibilities of a critical care nurse. What are considered or what are the conditions that are considered as critical? Okay, what are the critical conditions or disease conditions? So we can say that the patient is critically ill. So these are acute respiratory failure, acute myocardial infarction, cardiac tamponade, severe shock, heart block, acute renal failure, polytrauma means injury in many organs. Okay, not only in one organ but many organs are injured or there is damage. Then multiple organ failure, many organs are not working up to their maximum level, organ dysfunction and severe burn. So these are some of the conditions that we can consider as critically ill patients. So in critical care unit, okay, there is classification of critical care patients. So we are classifying the patients, okay, very critical patient or who are mild, not so much of they are not at a high risk of death. Okay, so there is a classification of critical care patients. So there are 4 classifications. We start from level 0. Level 0 means normal ward care. Okay, patient is stable. Okay, so as a nurse we have to give normal ward care. Normal ward care like mouth care or dressing or help in giving a sponge bath. Okay, so all these are normal ward care. Okay, like catheters, providing a Foley's catheter, okay, care, or you can say dressing. Okay, so these are normal ward care. That is considered as level 0. Next, level 1. Patients who are at the risk of deteriorating and who require support from critical care team. So these are considered as level 1. Level 2, those patients who require more observation or intervention, single failing organ or post-operative care. Okay, so after the surgery, okay, so after any operation, so these type of patients, they require observation, continuous monitoring is required. Okay, and intervention is to be given, and such patients may have single organ failure. Okay, so such patients are classified under the level 2. Now, level 3, it is the most critical. These are considered as the most critically ill patients. Okay, so they require respiratory support or basic respiratory support. So they may be in ventilators. Okay, or they may be or they require suctioning. Okay, so they require oxygen, back mask oxygen. Okay, so these patients are under the level 3, and such patients may also have multiple organ failure. So means not only one organ is failed. Okay, मतलब जैसे for example like the kidney is failed. Okay, so only one organ is failed, then we can consider in level 2. But if many organs have been failed, like the lungs, the liver, okay, kidneys, so if they are failed, then it is called multiple organ failure. So we can consider them under level 3. So these are the 4 classification of critical care patients. Okay, now this is about patients. Now there is also a critical care unit. Okay, so classification of critical care unit. So there are 3 levels. Level 1 means that it provides monitoring, observation and short-term ventilation. The nurse-patient ratio is 1:3. Okay, so means that one nurse will take care of 3 patients. Okay, and the medical staff are not present in the unit all the time. So the medical doctors are not present in the unit 24 hours. Okay, whenever it is required, then the nurse will call the doctors and they will come to the ICU. So this is level 1 classification of critical care unit. Next, level 2. Okay, this provides observation, monitoring and long-term ventilation. Okay, so in level 1 it requires short-term ventilation, whereas in level 2 it requires long-term ventilation. Means patient will be in continuously they will be kept in ventilators. With resident doctors, the nurse-patient ratio is 1:2. So here the resident doctors are there. Resident doctors, they are the postgraduate doctors. Okay, so the nurse-patient ratio is 1:2. One nurse will take care of 2 patients, and junior medical staff is available in the unit all the time. So 24 hours the junior doctors will be there. okay, those who are pursuing MBBS, okay, the interns or the third years or the third years of the interns, okay, so those are called, they are considered as junior medical staff. So they will be present in the ICU 24 hours, and consultant medical staff is available if needed. So if we require to call if there's anything coming up, in any emergency coming up, or something is not right with the patient, then we can call the consultant medical staff. So I hope this is clear about level 2. Now coming to level 3, provides all aspects of intensive care including invasive hemodynamic monitoring. Okay, so cardiac monitoring, continuous cardiac monitoring is required. Patient is on continuous ventilator. Okay, patient requires intensive care, sterility to be maintained, and patient may also require dialysis. The nurse-patient ratio here is 1:1, one nurse, one patient. So this is level 3. So in critical care unit, the classification of critical care units, there are three levels: level 1, level 2, and level 3. I hope this is clear. There is no confusion, right? Okay, there are two classifications. One is classification of critical care patient, where we are classifying the patient based on their needs. Okay, so there are 4 levels: 0, 1, 2, and 3. 0, 1, 2, 3. Whereas classification of critical care units, there are 3 levels: level 1, level 2, and level 3. Now coming to the types of critical care, you must be aware of this. Okay, so I'll just brush up. So NICU, neonatal intensive unit, special care nursery, SCN, pediatric intensive care unit, PICU, psychiatric intensive unit, PICU, coronary care unit, CCU, cardiac surgery intensive care unit, CSICU, cardiovascular intensive care unit, CVICU, medical intensive care unit, MICU, medical surgical intensive care unit, MSICU. Then there is an overnight intensive recovery, OIR, neuroscience or neurotrauma intensive care unit, NICU, neuro intensive care unit, NICU, burn intensive care unit, BNICU. Next, surgical intensive care unit, SICU, trauma intensive care unit, TICU, shock trauma intensive care unit, STICU, trauma neuro critical care intensive care unit, TNCC. Next, respiratory intensive care unit, RICU, and geriatric intensive care unit, GICU. So there are many types of ICUs. Okay, so there are many types of critical care unit. Okay, so I hope this is clear. Next, we have the types of ICU. So it is classified into general ICU and specialized ICU. General ICU means general medicine, general disease conditions. Okay, like medical ICU. Okay, medical ICU, surgical ICU, medical surgical ICU. So it is general. It is not specialized. Next, we have a specialized ICU like neonatal ICU, specialized only for babies, special care nursery, pediatric intensive care unit, specialized only for pediatrics, coronary care unit. This is specialized only for coronary arteries or leading to the heart. Cardiac surgery intensive care unit. Okay, any post-operative management of the heart. Next, neurosurgery. Okay, neurosurgery, any post-operation of the brain. Burn intensive care unit, specialized only for burns, and trauma ICU, related to any trauma or accident. So these are the types of ICU, classified into 2, specialized and general. Now coming to the principles of critical care nursing. Okay, as a nurse, we have to follow these principles, and we have to keep it in mind whenever we are in the ICU as well. So first is anticipation. Okay, the first principle in critical care is anticipation. Means that one has to identify, or one has to recognize the high-risk patients. Who are the patients who are level 0, who are patients in level 1 or level 2 or level 3. So we have to anticipate, okay, and we have to anticipate the requirements. What patient is required? Is he or she requiring normal care, or level 2 care? So it depends on that. Unit is properly organized in which all necessary equipment and supplies are mandatory for smooth running of the unit. So anticipation is one of the first principle of critical care nursing. Next, early detection and prompt action. So the prognosis of the patient depends upon the early detection of condition, aberration, prompt and appropriate action to prevent any complications. Monitoring of cardiac respiratory function is of prime importance in assessment. So we have to detect, okay, if there's any other problem in the patient, okay, and if this, we have to prevent any complication. That is why we have to give prompt action or appropriate action to prevent any further complications. So that is the second principle. Third principle is collaborative practice. Collaborate. What do you mean by collaborative? Means to collaborate, to join, or to have a connection with someone else, right? So collaborative practice here means that the nurse should not only have a good interpersonal relationship with the other nurse, but they should have good IPR with the doctors. They should have good IPR with the lab technicians, with the housekeeping staff, or with the those persons working in labs, okay, or technicians. So there should be a good bonding, or there should be a good communication, interpersonal relationship between the two. So that is called collaborative practice. Next, communication. So as a nurse, you should have good communication. Okay, because communication is one of the most important principles in nursing. Okay, if this communication is not maintained, or communication is not, it is not there, it is not fully managed in the ICU, then there can be misunderstanding. Okay, so misunderstanding can lead to a lot of problems. So communication is one of the most important principle of critical care nursing. So intraprofessional means nurse to nurse. Okay. Next, interdepartmental, meaning nurse and doctor, or nurse and housekeeping staff, or nurse and physiotherapist, or nurse and nutritionist, or nurse and counselor. Okay, and interpersonal communication has a significant importance in the smooth running of the unit. Collaborative practice of communication 1. So communication should be there. Next, prevention of infection. Okay, as a nurse, critical care nurse should have good knowledge, should have high knowledge in order to prevent any further complications. And the important responsibility of a nurse is to prevent any infection while taking care of the patient. So sterile technique, aseptic techniques should be followed in the ICU, and a nurse should follow aseptic techniques in order to prevent any infection. Next, crisis intervention and stress reduction. Okay, so partnerships are formulated during crisis. Bonds between nurses, patients, and families are stronger during hospitalization. As patient advocate, nurses assist the patient to express fear and identify their grieving pattern and provide avenues for positive coping. So crisis intervention. Crisis here can be because of the patients, depending upon their condition. Okay, some patients may not live for a long time. Okay, so they may have fear, or they may have anxiety or fear, and they may be depressed. So as a nurse, we have to go and counsel them. Okay, we have to talk to those patients if they are stable. Talk to those patients, and talk to the family members also, and we should help them to express their feelings or express their fears, and try to bring a positive impact on their life. So that is crisis intervention and stress reduction. We have to reduce the stress of the family and also reduce the stress of the patient. So that is the end of the topic for today. I hope you've cleared about this. Okay, so that is about critical care nurse, critical care unit. So thank you, class.